I discovered very early in my medical internship that I had a lot to learn from nurses. You ready?
Sure.
Okay. Good morning. I'm Dr. Baker, the new intern.
Oh, God.
Nurse, do you have any questions for me about Mrs. Jones in room 6?
Mrs. Jones, Mrs. Jones. Do you mean the 86-year-old diabetic lady who is admitted with cellulitis and a hemoglobin A1C of 13.7?
Oh, yeah, that's right. And
The lovely lady who fell and cut her leg, but she didn't see her doctor for 5 days because the poor dear didn't want to bother her daughter, who's a single mom with 2 teenagers?
I didn't know that part.
Do you mean Sarah Jones, who's being treated with vancomycin, Zosyn, insulin, glucophage, and Soaks QID? That, Mrs. Jones?
Yes, that's right.
No, I have no questions.
Okay, thank you.
Do you have any, doctor?
No, I don't have any now.
Good. Well, I'll be here if you need me.
Thank you. Let's say this napkin represents healthcare, which we all know can use a little cleaning up. But we can also use the napkin to represent the vital role that nurses play in taking care of patients. You see, as doctors, we make the diagnosis, we write the orders. You could say that we get the process going. But the real work of healing, well, that's done by nurses. Now, people who don't understand that think that nursing is just a very small part of healthcare. So, to represent what they think, I'm going to tear off just a little piece of the napkin. And we'll leave it here for the moment. That's the little nurse's piece that people think represents the little part that you play. But what you and I know is that when it comes to patient health care, if you remove even that small piece, it leaves a very big hole. And there's only one thing that can fill that hole, and that's the nursing piece. Because when it comes to patient care, you are the true stars. We all know that healthcare is undergoing the most radical changes that we have seen in our lifetimes. Doctors, nurses, nurse practitioners, PAs, we're all being buffeted by forces beyond our control. I know I've certainly experienced it, and I've worked with many nurses over the 35 years that I was in practice, and I've seen how the changing medical world is affecting you. For instance, you tell me that there's never enough time to do everything that's expected of you, and never enough help. So, mandatory overtime, which we all love so much, right? And which does wonders for the home life. And I've heard that you're concerned about patient ratings and surveys and how they can affect your salaries in the future. And technology, which is supposed to make you more efficient, just ends up gobbling up your time. All of these factors come between you and the people that you're taking care of. So today, let's talk about some practical strategies and techniques that can improve the experience for you and your patients, so that you can get back to doing what you trained for, taking care of people. And these strategies won't take one moment more of your time and will help you to be even better at what you already do so well.